One of the things I think that we often get confused about is the race between fixation and fusion. Many different things in terms of improvement techniques and beneficial implants at this point can really help us achieve good surgical technique and ultimate immediate fixation. But as we look at this, we have different technologies that allow sometimes the cage to adhere to the vertebral body. We're losing larger and longer screws, but we also have to consider how we're going to get this patient to fuse. Whether it be through the inner body, the posterolateral gutters, or dorsally, we have to think about and consider different things like the host factor in order to get this patient ultimately to essentially adhere and achieve a fusion. By doing that, the patients ultimately do much better.